So how do you know that your sciatica is actually better? Are you completely recovered from sciatica? Well, that's a great question. And when I work with my patients, we're using these 5 signs and symptoms to help figure out, okay, are you better? Are you ready to get back to your life? We're gonna be talking about movement of the nerve. We're gonna be talking about mobility. We're gonna be talking about pain and strength. So all of those things are gonna come into play. And if those things are good, that means your sciatica nerve is healed up and that you're actually on the road to recovery. But this video is gonna be helpful for those maybe who've had pain for just a short period of time or maybe for a long period of time. But what you're gonna walk away with is a good foundation to figure out, okay, is the sciatic nerve actually better and healing up? And you're gonna know some tips and tricks along the way. And the last 2 in this video are the ones that I use the most with my patients to help figure out, okay, if you could do these things, then you're good to go. Like, get back to your life, do the things that you wanna do. So hope this video gives you some guidance and some hope to your recovery. But before we waste any more time, let's have some fun and get to those 5 signs and symptoms. So this one's a low-hanging fruit when it comes to sciatica and signs and symptoms related to healing, and that's pain. Obviously, if you have a reduction in pain, you know that you're feeling better and that your nerve's getting a little bit more nourishment, but how that pain is interpreted or changed in your brain is something that's pretty interesting. And so when you're looking at sciatica, you may have some irritation around the sciatic nerve in the lower back, maybe caused from a herniation, and that's sending the pain signals to your brain, and that's being interpreted from your brain to be determined as a threat or not, which would be causing pain or no pain at all. And what's really interesting with sciatica is that you can still have an herniation and have no sciatica at all because your brain is telling, like, it's being interpreted in a way saying, hey, like, that's not painful, like, this is okay, this is not harmful to your body. And so we do that through movement, and that when you move more and start doing more in your day and start feeling like yourself, you're able to send those feel-good things in your brain, and your brain just tells your body, like, hey, I'm feeling better, I'm healing up, even though mechanically the changes in your back may not be happening in that fast. And so it's really cool to think about of pain being one of the signs and symptoms related to healing, but how it works, it's really interesting in that what I want you to take away from this is that when you have discomfort and you start to feel like yourself and you start doing more of the things that make you happy and just get back to your normal life, your brain actually calms down the pain at the same time. And so while you may want another MRI to prove that that herniation is gone, you may not need that because your brain and your body is working together to make you feel better. And so pain is just a low-hanging fruit to talk about because, you know, it will get better. Pain is one of those things related to healing, but you may be feeling better and may not actually have the healing of the herniation in your back, and that's absolutely okay. But what happens when we move on to the other sign and symptom related to sciatica that we want to definitely track if you know that you're healing or not? It's strength, because with sciatica, one of the hallmark signs of that is a reduction of strength in your leg or your calf. So we're going to be talking about, okay, what does that actually look like when it's healed? So what's really cool about this is that when we're looking at strength in the leg, we can identify it and we can track it over time. And this is something I use with my patients that we're like, okay, is your sciatica getting better? Let's go back to this test to make sure that we're figuring it out. So unlike a muscle strain where you have like an impact in the muscle fibers, which would be uncomfortable, painful, and weak at the same time, when you have weakness from a sciatica or a nerve issue, it's not usually painful, but it's noticeably weak. And so you don't have that pain component because the electrical impulse getting to the muscle is just diluted. It's not as strong as it would be with a muscle strain. So it's not like you were running and strained your muscle. It was more of like, oh man, you're having some sort of nerve impingement, or you're having some sort of nerve thing going on that would cause a reduction of signal to the muscle, thus it's not as strong. So I want to show you what that test looks like and how you can track it over time. So remember, we're talking about the connection between the sciatic nerve and the muscle. So it may not be painful, but it will be noticeably weak. And that noticeable weakness comes from testing either the calf muscle or the front of the shin. And so we're going to look at both of those tests now, in that the calf muscle comes from a single leg like raise when you're doing a calf raise here. So you're going to be holding onto something sturdy. You're going to be doing 15 to 20 reps on your side that is feeling well, not having any pain. And what you will notice is either just a sign of just weakness where you haven't done it in a long time, but it doesn't feel like it's abnormally weak. So 15 to 20 is a normal range. You're going to go to the side then that you're having discomfort, and you're going to do the exact same thing. You're going to stand on one leg. You're going to go up lift your heel up and go on your toes. You're going to try to do that 15 to 20 times. What I look for a sign of healing is that you could do an equal amount side to side. If you're noticing a dramatic difference in your strength or your ability to do it on the side that you have pain, that is a sign of nerve weakness. And so while you may be feeling better, your sciatic nerve may not actually be 100% healed up. And so I'm not saying you need to be doing calf raises, but what I'm saying is that it's just a sign of the nerve healing. And so that's something that a lot of people don't think about, is doing that calf raise to kind of look at, okay, is that muscle back to where it was before? Now, the other muscle we were talking about, the anterior tib, which is controlled by the sciatic nerve as well, is your ability to lift your toes. And so I just have my patients heel walk. If they're able to heel walk and not having a drop in their foot, then that also tells me that the sciatic nerve is okay. So you may notice that in your gait, it's called drop foot, or how you walk. But from looking at those two muscles, we're kind of determining, okay, are you healing up? Well, that will answer our question is, okay, is that strength coming back from the nerve impingement or the sciatica that you have going on? Okay, so the third one talking about here is frequency of pain. And so intensity is what we talked about first, so how much or how high the pain is. Now we're talking about how often you have it. And so people with sciatica, if they have high intensity and high frequency, then they're often wanting to pursue other measures such as medication and injections, all of these things that come with risk. And that if we want to help your body heal, it's good to know that we're healing and the signs and symptoms related to healing. And so that's why we have to talk about frequency. And so frequency is how often you have pain. So let me give you an example. When I treat patients and they're acutely in discomfort or just had something recently happen causing pain, they usually have high intensity and high frequency. Now, over time, as we're looking at the healing of it, we want to notice a reduction of each of those. And so sometimes in those patients, we may have high intensity pain, but we may notice a sign related to healing is that it's less often, and that, hey, I'm still having a lot of troubles bending over or sitting, and I'm having a lot of pain, but I'm noticing that it's not as frequent. I'm able to sit a little longer and have less pain, or I could do more of my day and not have as frequent discomfort, but when I do have it, it's still really intense. And so frequency is really important in that I always ask that question of like, hey, you may not feel like you're getting better. You may feel like things haven't gotten better over the last 2, 3, 4 weeks, but this is what I've noticed is that you're able to do more and you still have discomfort. And so as soon as you can get that little glimmer of hope that you're healing, things really start moving along and that you could do more and feel more confident in your movement and know that what you're going to do isn't going to flare you up. You may have discomfort, but it's not going to make you worse. That's a good place to be when it comes to sciatica. So frequency of discomfort is very, very important. And so we've noticed, okay, a reduction in pain, that's obviously a sign of healing. You're getting some strength back in your leg. You're noticing, hey, I still may have a little difference side to side, but hey, I'm getting better in my strength compared from the first time I tested it and then 2 weeks later. And then now we're talking about frequency and how often you're having pain. And now these last two are the ones that people really care about the most. And we're going to be talking about your ability to bend over, and we're going to look at the nerve sensitivity. That'll be the last one. So let's talk about bending over and what happens during sciatica. How can you tell you're getting better? Okay, so this one's a good one. So a lot of people have difficulties bending over or forward fold or some sort of arching your back when you have sciatica. And let me explain why. Is because when you have your sciatica caused from a disc herniation, that disc is moving posteriorly or backwards just slightly when you are bending forward. And when you bend forward, it exposes the nerve a little bit and that disc moves back a little bit and it gives you a sharp shooting jolt of discomfort. If you truly have that, you're going to notice that bending over isn't great at all, and that when you sit for long periods of time, especially in a soft couch, it's not good at all. If you have those two things, then you know that bending over is important to you, and if you can bend over more, like put on your shoes and socks and put on your pants, you know that you're healing up and feeling better. So that's something that we test. And so I look at my patients and their ability to forward fold or flex their lower back and how far they can reach over time. Now, at first, it is completely normal to when you go to try to bend over and you even look down with your head and start to round your back, you have symptoms right away. You can go zinger down the leg or in the back or the glute, and that is okay. Like, that is just where you're at. But over time, when we're looking at signs related to healing, we're going to be able to bend over more and more and have less discomfort in the lower back. Now, is my goal for you to be able to touch your toes if you've never been able to touch your toes in your life? Well, no, absolutely not. I just want to get you back to where you were, and then we're going to work on the mobility of the nerve after. So when you're looking at the spine and you go to forward flex and bend over, it does put a little pressure on those posterior nerves that can send pain down your leg. And so that's why walking tends to feel a little bit better, and bending over can be the devil in the very beginning, especially if you have just a really bad bout of sciatica. So bending over is important. Related to healing, I want to get you be able to bend over, forward flex, look it down and not have pain down your leg. And now what's causing that is from the sensitivity of the nerve. And this last thing that we're going to talk about is a test that I use to gauge sensitivity, but then I also treat it at the exact same time. This is my favorite thing to do with sciatica. It is very impactful, but it is a huge thing related to healing. If you could do this, you know your nerve is feeling better. Okay, so this is the last one that I typically test with my patients to be like, okay, if we could check this off, we know your sciatic nerve is doing really well. And so this is called the Slump Test. I'm gonna run you through it, and we're gonna be learning about what it should feel like, but if you could have equal range of motion on side to side, that's what we're looking for. So what we usually do is we usually sit in a chair, and as the slump test, you would expect that you're going to have to slump in your posture, and that you're going to kick out one leg and pull your toes back and then slump way down. Now, I would start in the side that you don't have discomfort in first so you can get a baseline. So let's stay on day one and the side you don't have discomfort in. You can get here and you can have full range of motion and feel pretty good. Your leg can get almost straight and you're feeling pretty good. But then you try to do the side that you're actually having pain down, and even when you go in the slump position, you have pain down your leg. Then that's it. Like, that is where you're at. Now, let's say 3, 4, 5 weeks from there, you're gonna keep testing it as you go, and you're going to kick out that leg, you're gonna pull your toes back, and then you're going to slump over and stop when you have discomfort down the leg. And that's where you're at. So I would expect you to have equal range of motion and equal feeling side to side to be like, hey, normal slump test, you're good to go. Now, let's say if you're having pain, you go to kick out your leg, you go into a slump position, and you feel your discomfort right away. Well, then we treat it there with the exact same movement. This is nerve mobility. We're teaching that sciatic nerve to be tolerant of movement. And this is the exact same thing as you being able to bend over and touch your toes or flex your spine, which we just spoke about. And so what you're going to do is you're going to sit up tall, you're going to kick that leg out, pull your toes back. Kick your legs out, pull your toes back. Kick your leg out, pull your toes back. And that's gliding that beautiful sciatic nerve to give us some nourishment and some healing. You're gonna do that 20, 30 times. And what's great is that you can do this at work or at home. You just wanna be in a supportive chair and kick your legs out and pull your toes back. Now, let's say that's starting to feel good, you're loosening up, then you can get a little bit poorer posture and kick your legs and kick your leg and pull your toes back. So typically, if I'm treating a patient that's like just started sciatica, I don't have them do as much range of motion. But let's say you've had sciatica for maybe 5 weeks, then I have them do full range of motion, try to slump your body into poor posture and pull your toes back. This is a great way to treat that sciatic nerve. And then when I treat you over time and when you're thinking about, okay, am I getting better? Am I healing up? Is my sciatic nerve just good now? Then I can be like, okay, let's test both sides, test your range of motion, and test how it feels. It is normal to feel tight in this. Even on the side that you don't have discomfort, you may notice, like, man, I feel really tight. So this could be a good stretch just for your nerves in general. But you're gonna kick your legs out, pull your toes back, and have a good slump posture. So today we talked about 5 really good ways to notice, okay, is my sciatic nerve getting better? Are you having less pain? Are you having less frequent discomfort and less intense discomfort? Are you able to bend over and touch your toes? How's the mobility of the nerve? And how's the strength in your leg? And so when we're looking at sciatica, the hallmark signs and symptoms related to that is pain and weakness and sensation changes. And if we're looking and assessing those things over time, we're gonna know that you're getting better. And so you may not notice all of those things getting better at once, and you may notice one getting better faster than another, and that is completely fine. That's just the way your human body works. It's not a textbook, but these are 5 things that we're looking at. Okay, if we're noticing improvement in these areas, then we know that you're getting better. But if your strength is back and you're able to bend over completely and do this slump test, you know that you're good to go. You can start doing some heavier strengthening and get back to your life and just kind of do some of this stuff if you need to along the way if you're feeling stiff. So hope you guys found this video useful. Great things came from this. Like, we're looking at the sciatic nerve and sciatica. Are you better? Well, if you can get through those 5 things, then I'm confident to say that you are definitely better than when you started. And so hope you guys found this information useful. Please leave a comment underneath the description of the video. Tell me about what you guys thought of this and where you are in your sciatica healing and journey.